Hello guys, welcome back to Clinically Clear. Today we'll be covering everything regarding infant mortality and early neonatal care. So infant mortality rate. It is the number of infant deaths, that is number of deaths within the age of 1 year divided by the number of live births in a given year into 1000. So the current value in India infant mortality rate is about 28. It is the best indicator for overall development of the nation. So infant mortality rate, it tells you the overall development of the nation, and the most common cause of infant mortality in India is low birth weight and prematurity. Very, very important. Low birth weight and prematurity is the most common cause of infant mortality. In the world, it is pneumonia. Now, let's look at the causes. We can have neonatal causes leading to infant mortality, that is dying within 1 month, and post neonatal, that is with after 1 month but before 1 year, because we're talking about infant mortality. So neonatal causes, again, which is the most common, low birth weight, prematurity. You can also have birth injuries, congenital anomalies, etc. Then you can have post neonatal causes like pneumonia, diarrhea, malnutrition, etc. Why we say that low birth weight and prematurity is the root causes? Low birth weight and prematurity itself can lead to pneumonia, diarrhea, malnutrition. They itself are risk factors. So low birth weight and prematurity is the root cause of infant mortality in India. So these are the causes of infant mortality: neonatal causes, postnatal causes. Most common cause, low birth weight and prematurity. Then coming to infants at risk. Who are the infants who are at risk of getting an illness or getting something and dying? So basically, first is birth order more than 5. What is birth order? Basically, second child in the family, birth order is 2. Third child 3, fourth child 4. So more than 5 children, basically mother's sixth child, seventh child, they're all birth order more than 5. So birth order more than 5. If the infant has protein energy malnutrition or diarrhea, if the infant is on artificial feeds, not breastfeeding, but instead on artificial feeds. If the infant is of low birth weight, born with low birth weight, less than 2.5 kg, less than 1.5 kg is very low birth weight, less than 1 kg is extremely low birth weight. So low birth weight can be due to prematurity. Again, prematurity itself can lead to low birth weight. What is prematurity? Birth before 37 weeks of gestation. IUGR, intrauterine growth restriction, can lead to low birth weight, where you will see SGA babies, small for gestational age. So this is low birth weight, that itself is at risk. And in India, low birth weight is a huge problem. 22 to 25% of births in India, they are of low birth weight. So low birth weight, then something related to weight, again failure to gain weight after 3 months. So again, some low weight of the baby less than 70% of expected weight, again low weight. Twins are usually born premature, so prematurity. Then working mother or single parent or working mother, then also the infant is at risk. So these are all the risk. When an infant is at risk of infant mortality, you say that birth order more than 5, protein energy malnutrition, diarrhea, artificial feed, low birth weight, failure to gain weight even after 3 months, weight of the baby less than 70%, twins, or working mother and single parent. Working mother or single parent. These are all infants who are at risk. Then factors affecting the rate, the infant mortality rate itself. Age at pregnancy. High risk pregnancy where the mother was less than 19 years old, teenage, or more than 35 years old, then the infant mortality rate will increase. Birth order. Maximum infant mortality rate is at first childbirth. First delivery, maximum chance of infant mortality. Second one, least chance of infant mortality rate. After that, third, fourth, fifth, as you go on, increasing the birth order, the infant mortality rate will also increase. So remember, this is an important point. First birth order 1, maximum infant mortality rate, birth order 2, minimum, and 3 onwards it goes on increasing. Then birth spacing, basically, let's say a woman gives birth at 2004 or 2005, and let's say 2005, then next pregnancy 2006, so 1 year interval or one less than 1 year interval, then there is a higher chance of infant mortality rate. If the next pregnancy was 2008, 2007, then 2 to 3 years of gap interval between the twos, there's a spacing of pregnancies, spacing of births, lesser chance of infant mortality rate. Sex, Female infant mortality rate is more than male in India. That is because of the patriarchal mindset in our country, conservative patriarchal mindset. So there is parental negligence. Basically, they are negligent towards the needs, the healthcare of the female child when compared to the male child. Then maternal education. Lesser the maternal education, less educated the mother is, the less nutrition awareness she has, the less health awareness she has, so higher chance of infant mortality rate. Some traditions or customs or habits like applying cow dung on the umbilical stump or the umbilical cord, this can lead to neonatal tetanus. Discarding the colostrum. Colostrum has a lot of antibodies, a lot of nutrients, so it is very, very important. But in some communities, they discard the colostrum. So all this can increase the risk of infant mortality rate. Low socio-economic status, then they won't have any, they'll be living in a very poor area, lack of hygiene, lack of sanitation. They won't have any access to good quality healthcare. They'll have less chance of education, nutrition education, health education. So higher risk of infant mortality rate. These are all risk factors: sex, birth spacing, birth order, age of pregnancy, customs and habits, maternal education, and socioeconomic status. Then prevention of infant mortality rate is mainly through early preventive pediatrics. Early preventive pediatrics is whatever you do for pediatric care within 1 year, kangaroo mother care, education of the mother, and breastfeeding. These four are the preventions which I'll explain in detail now. So basically, let's start with early neonatal care. So you have AA, B, C, D, E. What is A? A is first Apgar score. So you will do the Apgar score. What is Apgar score? Activity, pulse, grimace, appearance, and respiratory effort. So you will put 0, 1, 2, and Apgar score, normal score is 7. You'll add for each one of them, you'll add the score you get. More than 7, normal Apgar score. Less than 7, abnormal Apgar score. Now, activity, 0 meaning no activity. 1 meaning some flexion is there. 2 meaning baby is actively moving. Pulse, 0, 0 beats per minute. 1, less than 100. 2, more than 100. Grimace. Grimace is basically when you give a stimulus near the nose of the baby, no response, 0. 1 meaning grimace. What is grimace? Some sort of facial expression. Cough or sneeze. Baby gets irritated and coughs or sneeze. So, very active, very normal. Appearance, fully cyanosed, blue, 0. Full blue baby. Pink central body, blue extremities, score 1. Score 2, pink, whole body is pink, normal. 0, no respiratory effort. 1, slow, irregular breathing. 2, good cry, good respiratory effort. This is Apgar scoring. See, the scoring part is not that particularly important, but the normal score more than 7 and the components, this is very, very important. Then coming to the next A, that is you have to check, clear the airway, you have to maintain the airway. Then come to B. B is very important. Body temperature maintenance and congenital anomalies. Basically, you will look for congenital anomalies like imperforate anus. If there is no anal opening, then there is no. If you feed the baby, it can lead to dangerous bowel obstruction, all that stuff. So, and choanal atresia. If the nasal choana both are closed, membrane is there or some bony atresia is there, then baby won't be able to breathe. So you have to immediately detect it. So these are certain congenital anomalies. Body temperature maintenance. Hypothermia, low body temperature, is the most common cause of death from in between 24 to 48 hours. So that is why, to prevent this hypothermia, there is something known as WHO warm chain. As soon as the baby is delivered, you will first cover it with a cloth and then you'll cover the head. Why will you cover the head? Baby's head is very, very large. So there's a lot of heat loss. So you'll cover the head, you'll wrap the baby up with a cloth. Then when you're weighing the baby, you will unwrap it, you'll weigh the baby. Again, you will re-wrap it, you will recover it, and then only you will hand it over to the mother. So baby is almost always covered with a cloth to prevent hypothermia and to maintain body temperature. So body temperature maintenance very, very important to prevent hypothermia through WHO warm chain. Cover, uncover, weigh, and then again cover and give it to the mother. Then C, cord care. Clean cord you have to maintain. Delayed cord clamping. You should not apply any cow dung because that can lead to neonatal tetanus. So just a bit of elaboration regarding umbilical cord care. D is dermal care. Basically, no bathing for the first 24 hours to stabilize body temperature. Again, we want to prevent hypothermia. If we bathe the baby in water which is generally colder than body temperature, what will happen? Baby will lose heat. So for the first 24 hours, we don't want the baby to lose any body temperature. We want it to stabilize. So that is why no bathing for the first 24 hours, because otherwise it will lose heat through the skin, right? When you take bath. So that's why dermal care. And E is eye care, to prevent ophthalmia neonatum or neonatal ophthalmic infections. You'll wipe the eyes from inside to outside with clean water or normal saline. So this is how you do early neonatal care. Neonatal care. So A, B, C, D, E, UPCAR scoring 7 to 10 normal. Then airway, check clear if it's there. Body temperature maintenance through WHO warm chain and congenital anomalies. Cord care, keep it clean. Delayed cord clamping, don't apply any cow dung. D, dermal care, no bathing for first 24 hours. Stabilize the body temperature. E, eye care, wipe it with clean water and normal saline. Then KMC, kangaroo mother care, guaranteed 3-mark question in almost every exam. So what is this? It was developed by Dr. Hector Martinez in Colombia. Basically, 4 main important. Basically, what you will do, the baby in vertical position is kept on the bare chest of the mother for a prolonged duration. What are the advantages? Same, skin to skin contact. It prevents hypothermia. Skin to skin contact with the mother's chest. Don't write mother's abdomen or mother's back or anything. Skin to skin contact with the mother's chest prevents hypothermia. A, ambulatory support in case of early discharge from the hospital. So that is ambulatory support. N, nutritional support through breastfeeding. If the baby is constantly kept on the mother's chest, then the efficiency of breastfeeding will also increase. So nutritional support is given to the baby. E, emotional bonding. By always keeping the baby so close to the mother, there is better bonding, emotional bonding between the mother and the baby. So kangaroo mother care, very very important. Low birth weight babies, skin to skin contact prevents hypothermia, ambulatory support, nutritional support through breastfeeding, emotional bonding. Now we also do something known as rooming in, where as soon as the baby is delivered, we place it as close to the mother as possible, so that emotional bonding takes place. Anxiety is reduced in both the mom and the child. The mother and the child, anxiety will reduce, because they're all, mother is anxious whether her baby is okay. Child also wants to be next to the mother, then the anxiety will reduce. So rooming in is highly advantageous. Next, coming to something very very important when it comes to early pediatric care, that is breastfeeding. Why always everyone recommends breastfeeding? Breastfeeding is always safe, most cases, not always, most cases. Clean, hygienic, no infections, nothing. Very very nutritious. Most nutritious thing you can give to a baby is breast milk. Cheap, economical. Mother does not have to spend even a single rupee, so it is cheap. Emotional bonding. Every time there is milk ejection reflex, oxytocin is released, and we know that oxytocin is also called as love hormone. It is responsible for emotional bonding. So emotional bonding is also achieved through breastfeeding between the mother and the child. Now, how does it happen? What are the phases of breastfeeding? First 3 days, the first milk produced is colostrum, which is slightly yellowish in color or straw color. Basically, in this, the fat content is very very less. Lot of carbs, lot of protein, and lot of antibodies provides passive immunity to the child, especially IgA antibodies. Colostrum, IgA antibody, very very important for the first 3 days. Then from 3 days to 2 weeks, that is 14 days, transitional milk is produced. After 2 weeks, it is mature milk. This mature human milk, it takes 2 weeks postpartum, and this is the complete diet for the newborn. There is nothing more nutritious you can give to a newborn baby than mature milk. So if you compare it with animal milk like cow's milk, goat milk, buffalo milk, fat, protein and energy actually in human milk is less. Of course, because see, a baby won't be able to digest a lot of protein. So therefore fat, protein, energy, all this is less in human milk when compared to animal milk. Whereas carbohydrates, which is basically lactose, much more in human milk than compared to animal milk. This is a very important point. Fat, protein and energy less in human milk when compared to animal milk. But carbohydrates like lactose, it is more in human milk. How often will you feed the baby? Frequency of feeding. You will do demand based feeding. That is, every 2 hours you will feed the child. And until it's burps, you will keep breastfeeding until the baby burps. So every 2 hours until burping, you will keep feeding. So approximately 6 to 8 times per day. Obviously, night time you won't feed, but 6 to 8 times per day, 6 into 2, 8 into 2, 12 hours or 16 hours, that's the waking hours. So every 2 hours, burping after feed, you will do the demand based breastfeeding. And during every feed, one thing which is important is it is not always that during breastfeeding also the same milk is produced. No. Initially, fore milk is produced. Then hind milk is produced. Now, both are different. Fore milk is more of watery consistency. So it quenches the thirst of the baby. Hind milk is rich in fat. It is thick. It satisfies the hunger. It gives satiety to the baby. So fore milk and hind milk. That is why it is very, very important that the mother is always advised to empty one breast, then move to the other. If she only does breastfeeding in one breast, for about half the duration, and then switches to the other breast, then what will happen in both the breast? Only the fore milk is released, the hind milk will not be released. So complete breastfeeding from one breast so that the baby gets both fore milk and hind milk, and then only move to the other breast. That is why it is very, very important to tell this to the mother. Then, see, most cases breastfeeding is safe, including TB and HIV. In TB and HIV also, WHO says that under all circumstances, continue feeding. It is most of the time safe. We can give prophylactic chemotherapy to the baby, right? Even though mother is close contact, we'll give prophylactic chemotherapy to the baby to prevent it from getting TB or HIV. But breastfeeding you should continue because this breast milk is very, very important. But there are certain contraindications. Galactosemia in the infant. Infant can't tolerate galactose. So therefore for that you should not do breastfeeding. Galactosemia, it is absolutely contraindicated. Mother undergoing chemotherapy, receiving immunosuppressive therapy, or if the mother is a heroin addict, cocaine addict, all these cases breastfeeding is contraindicated. So does that mean you leave the baby starving? No, you will go for artificial feeding. This also, artificial feeds also, you will give 6 to 8 times per day. The principle of artificial feeding is 100 kilocalorie per kg per day, 10 grams of carb per kg per day, 2 grams of protein per kg per day. For the first 4 months, you will do dilution in cow's milk, 1:3 dilution. After 4 months, you will not dilute it. You will just put this in cow's milk, dissolve this in cow's milk, and you will feed the baby. When breastfeeding is contraindicated, only then you'll go for artificial feeds. Same frequency, 6 to 8 times per day. 100 kilocalorie per kg per day, 10 grams carbohydrate per kg per day, 2 grams protein per kg per day. Up to 4 months, 1:3 cow milk dilution. After 4 months, no dilution. No. There are certain laws or accredits or evaluation for breastfeeding guidelines. Basically, everything related to breastfeeding guidelines. Now, UNICEF gave something known as BFHI, Baby Friendly Hospital Initiative. This Baby Friendly Hospital Initiative has 10 steps. Various steps are there. Exclusive breastfeeding, kangaroo mother care, this, that. There are many different steps. Little important, but not that important also. If you want, you can learn it basically. But the problem is it requires a lot of effort, lot of facilities, money, which is not feasible in India everywhere, right? So government of India went for its own one, that is Ma program, that is Mother's Absolute Affection. Mother's Absolute Affection gives us the breastfeeding guideline. The three most important guidelines are: start breastfeeding as soon as possible. Within 1 hour after normal delivery, you have to start breastfeeding. Within 4 hours after C-section, you have to start breastfeeding. And exclusive breastfeeding for 6 months. That is no water, no complementary feed, no artificial feed. For 6 months, only breastfeeding, and continue breastfeeding to up to 2 years. Continue breastfeeding up to 2 years along with complementary feeding. But only breastfeeding for 6 months prevents infection. Then there is something known as IMS Act, which was amended in 2004. Infant milk substitutes, IMS. Feeding Bottles or Infant Foods Regulation Act. This is the full form. Mainly infant milk substitute. What is the infant milk substitute? Basically, artificial feeds. Now, artificial feeds are important. They are sold because there are some indications for artificial feeds. But when artificial feeds is not indicated, breastfeeding is totally fine. Why do we need artificial feeds? It will actually harm the baby. So therefore, this act says that there should be no public advertising, no public marketing for these artificial feeds. Olden days, every day on TV, Cerelac advertisement, Nestle baby feeds advertisement. Now you won't see a single one because it is not allowed. No public advertisement is allowed for artificial feeds. Very, very important. So, baby friendly hospital initiative by UNICEF, 10 steps not done, not followed in India. Ma program, very, very important. Exclusive 6 months within 1 hour of normal delivery, within 4 hours of C-section. And Infant Milk Substitute Act 2004 amendment. No public advertising for artificial feeds or complementary feeds. No bottle feeding, nothing. You should not do any of that. That all comes under this act. So, little long video. Hope you guys enjoyed it. Thank you for watching.